I earned my degree online at Arizona State University. I chose to get my degree at ASU because I knew that I'd get a quality education, they were recognized for excellence, and that I would be prepared for the workforce upon graduating. To be associated with ASU, both as a student and alum, it makes me extremely proud, and having experienced the program, I know now that I'm set up for success. Learn more at asuonline.asu.edu.
What's up, everybody? You're listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have physical therapist Dr. Tyler Betteridge with us, one of our 2 sports residents here at R2P who practices out of our Germantown location. And he's got a research article to share with us today that we just wrapped up the month of March, which focuses on the elbow, wrist, and hand. And Tyler, I believe you picked one that looks at movement quality and the potential for increased elbow stress during pitching. Do you mind telling the listeners what was the actual title of the article that you chose, and why did you choose it?
Sure. So the article I chose was The Association Between Lumbopelvic Stability During a Single-Leg Step Down and Elbow-Varus Torque During a Baseball Pitch. Reason I chose this was I was looking through articles trying to find one for this month that looked interesting, and I saw this one pop up. And it reminded me of a conversation we were having a couple weeks ago where I was asking you about a current patient that I have rehabbing his shoulder post-op and also has some UCL strain involvement as well. And we were kind of in this, I'm kind of in this phase where the protocol is restricting me from loading the upper extremity a little bit more. So I was just kind of picking your brain on other interventions that we could include, and a point that you brought up was not to forget about the lower half. So I thought that looking at movement qualities in the lower body in regards to pitching and how that might influence mechanics and risk of injury in the upper body during a pitch, I thought that this would be a good article to kind of analyze some of the different qualities we can look at as PTs and how those different qualities can help our patients who have upper extremity injuries.
Cool. And I think whenever we get into injury prevention, I'm kind of doing that with air quotes right now, or performance enhancement, you separate it into 2 categories. We either think about just improving the kinetics or the kinematics with an individual. Kinetics mean all the things that you can measure. Can we get them stronger? Can we get them more powerful? Can we get them faster? And then the kinematics associated more with the quality or the expression of movement, kind of the do biomechanics matter conversation. So this month we had our other resident talk about analyzing a counter movement jump and all of the different force-based metrics associated with that, and did that correlate with anything from a performance or injury standpoint. And I like that your article is kind of the other end of the spectrum. Not necessarily the amount of force or the time that we generate that force over, but what does the actual movement look like? What is the quality of the movement? Is there any abnormalities associated with a standard movement that could correlate to pitching injuries? So, Tyler, give us a little rundown on what this trial actually looked like. How was it set up? Who was included? What were the tests that they did?
Yeah, so this was a cross-sectional study involving 44 NCAA Division I baseball players. They were at the average age of around 19, around 6 foot, and average weight of about 200 pounds. The eligibility criteria for this study was that they had to be an active pitcher on an NCAA Division I baseball team. And the exclusion criteria was that any injury in the throwing elbow at the time of the study, or any injury requiring at least 2 weeks of rest from playing in the 6 weeks before the study as well. So basically all of our pitchers had to be healthy, no recent upper body injuries that was holding them out of play. And then as far as the methods for the study, the participants completed 2 different assessments within 48 hours, one being a bout of pitching to assess their elbow-Varus torque and ball velocity, and the second one being a single-leg step-down test to assess their lumbopelvic stability.
So we have them doing some throwing, and we also have them doing a step-down motion. Can you give us a little bit more details about the throwing or the pitching assessment they did? And then can you also elaborate a little bit on what this single leg step down test included? Because it looks like they did a couple different things in there that were pretty cool. And I'm curious to see what they were exactly, and then diving into some of the results after that in regards to did it matter?
Yeah, so as far as the pitching assessment goes, the pitchers had to they went through their typical warm up, including mobility bands and a long toss. Then they threw 10 fastballs from a regulation size mound to a catcher. 5 of those repetitions were at 75% effort. 5 were at 100% effort. They utilized a inertial measurement device that was secured to the ulna to measure Elbow-Varus torque during the pitch. And then they also used a Stalker Sport 2 radar gun to measure ball velocity. In regards to this single leg step down test, the pitchers performed the single leg step down on a 8-inch box. There were 6 different inertial measurement units attached to the participants. So on the lateral border of the shank bilaterally on the lateral border of the thigh, one on the sacrum, and one on the sternum. Once those measurement devices were secured, the pitchers performed one set of 10 step downs on each leg under 2 different conditions. So one condition was a standard anterior step down, and then the other was a step down with the addition of a Stroop condition. The Stroop condition here was to, in their eyes, to try and emulate the cognitive demands that a pitcher experiences while trying to throw a pitch. So think like adding a dual task component to our anterior step down. This Stroop condition that they used was they played an audio recording of a random combination of 2 words, the words high and low, and they varied the pitch of those words as being high-pitched or low-pitched. When the word high or low was spoken, regardless of what word was stated, the pitcher had to state what pitch the word was set at. A lot of back and forth and pitches with that, but basically just looking at a dual task component with our single leg step down. And then they used a data analysis software to kind of synthesize this data and analyze it.
Cool. So they had them do 10 throws from the pitching component, 5 at a sub-max effort, 5 at a maximal effort, and then they were tracking Elbow-Varus torque during those throws. Then for the single leg step down, they're looking at lumbopelvic mechanics, doing 10 step downs from a 20-centimeter box, one just a standardized test doing 10 reps, and another where they add a dual tasking cognitive component to it, which admittedly I think I would struggle with just trying to do it without the single leg step down, let alone adding the single leg step down with it. What did they end up finding after they took the athletes through these tests? What did they find either with the pitching data, the single leg step down, or the combination of each?
Sure. And on just the pure data collection side, in regards to the pitching data, as far as torque and velocity, they were able to identify 2 clusters to group the pitchers into, one being a low torque, high velocity group, which consisted of 17 of the participants, and then a high torque, low velocity group, which consisted of 21. They did 21 participants. They did note that 6 of the pitchers had lost data and they were not included in the study. For the single leg step down, a principal component analysis yielded 4 dominant patterns of variability in movement during the single leg step down, and they separated this into both the trunk and pelvis during the single leg step down. They looked at transverse plane kinematics, sagittal plane kinematics, and then they separated frontal plane trail leg and frontal plane lead leg kinematics during this single leg step down. They used a logistical regression, which revealed that only the people who exhibited a higher transverse plane motion, both in the hip and at the trunk, under the Stroop and non-Stroop conditions, predicted higher odds of belonging in the high torque or predicted higher odds of belonging in the high torque, low velocity group on both the lead and trail legs. So all of that being said, if a pitcher exhibited higher transverse plane motion at the hip or higher transverse plane motion at the trunk, it didn't matter if it was a Stroop or non-Stroop condition, or if they were on the lead or the trail leg, they were predicted at higher odds of belonging in the high torque, low velocity group. Pitchers with increased transverse plane trunk movement were 2.9 times more likely to be in that high torque, low velocity group. And they also noted that pitchers with increased transverse plane pelvis movement were 2.5 times more likely to be in that high torque, low velocity group.
So summarizing all of that, we can basically say people who showed more transverse plane trunk movement, more rotational movement at the trunk or at the hip, they were going to have lower ball velocity, so decreased performance, and higher torque at the elbow, so potentially increased stress and increased injury risk at the elbow. Is that safe to say?
Yeah, exactly.
So what do we end up taking from this study? And as a clinician, either working exclusively with baseball players or working in a more generic outpatient clinic that just has a variety of baseball players coming in, what do you take away from this article, either from a testing standpoint or from an intervention standpoint with your athletes?
Yeah, so I'd say that the bottom line is that there is an association between lumbopelvic stability in kind of our simple in-clinic tests that we can do for lower extremity and the subsequent correlation to performance during a pitch. The study kind of highlights that in a single leg step down, though you may think that in your initial assessment, a single leg step down may have lower ecological validity when compared to the complex dynamic movement of a pitch. There are some similarities. So in a single leg step down, obviously we need a certain degree of gluteal control and strength in order to lower ourselves to the ground adequately and perform the test appropriately. Likewise, in the pitch, the gluteal muscles are in charge of controlling pelvis positioning and hip trunk dissociation in various phases of the pitch and are loaded in different ways throughout the different phases of a pitch and require their own subsequent gluteal strength. So I think that though it's not emulating a pitching motion and it's not a perfect test, I think it just gives us another tool in our tool belt that we can use to assess our athletes, especially like our athletes who are post-op, who have or may have chronic medial elbow issues. It gives us another assessment that we can look at to kind of try and dissect what may be causing some deviation in their pitching mechanics that might be biasing them to put more torque at the elbow and put them at increased injury risk.
Yeah, and a single leg step down test doesn't take a lot of equipment, doesn't take up a lot of space, and it doesn't take up a lot of time. So if I have an athlete that I'm trying to get a very well-rounded picture of their movement profile, and if they're coming in for elbow pain or shoulder pain or maybe back pain, you're obviously going to do whatever you need to own in on the injured body part and get all your traditional orthopedic tests there. But if we want to look at things more globally and see, is there something elsewhere in the body that may be contributing to more stress on this injured area, lower extremity mechanics and core stability are two things that we do want to address. They're areas for opportunity to build out a well-rounded strength conditioning program. For our youth athletes, it's great for body awareness. It's great for exposure to lower extremity strengthening in a very low risk, low impact, low intensity environment. And for our higher level pitchers, maybe our high school, college, or pro guys, it's a way for you to keep them involved in a training standpoint. Maybe if they are coming off a surgery or if they are being shut down for a period of time to minimize stress on the upper body from a recovery standpoint, it's ways to get meaningful training done. And if we know that lower extremity mechanics can influence up the kinetic chain to what they're experiencing at the arm, whether it's the shoulder or the elbow, it makes sense to look at it from a testing standpoint, and it makes sense to train it from an intervention standpoint. So, Tyler, appreciate you doing the dirty work on finding the article and sifting through the research for us. Pretty cool when you get articles that kind of verify what you think you already know, which is throwing is a total body motion. Yes, we need to train the arm, but we need to train the total body. And I think adding something as simple as a single leg step down test provides you an educational opportunity for your patient to show them a way that we can track and assess lower extremity movement, make sure it's putting them in a good position from a injury risk standpoint and a performance standpoint, and it helps add one more tool to our clinical tool belt. If you're listening and you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast.